HIV and AIDS screening test. This test is performed to determine if you are infected with human immunodeficiency virus, AIDS. It is recommended to be performed at least once when you are 13 to 64 years old, when you think you may have been exposed to the virus, before becoming pregnant or when pregnant, once a year if you are at increased risk of being exposed to the virus. The required sample is a blood sample collected from a vein in your arm or from a finger stick, and also can be performed on oral fluid. Human immunodeficiency virus, HIV, is the cause of AIDS. When a person becomes infected with HIV through exposure to the blood or body fluids of an infected individual, or a contaminated needle, for example, the virus begins to replicate itself, producing a large number of copies. Over time and without treatment, HIV destroys the immune system and leaves a person's body vulnerable to debilitating infections. HIV screening tests detect the HIV antigen, P24, and/or HIV antibodies produced in response to an HIV infection in the blood. Detecting and diagnosing HIV early in the course of infection is important because it allows for early treatment that slows progression to AIDS. An individual can learn of their status and modify behavior so as to prevent the spread of disease. This test should be performed also for people diagnosed with hepatitis B or hepatitis C, tuberculosis, or a sexually transmitted disease, and for healthcare workers with direct exposure to blood on the job, and any individual who thinks he or she may have been exposed. There is currently no vaccine to protect against HIV virus, but avoiding high-risk activities, such as having unprotected sex and sharing needles for injecting drugs, can help to prevent its spread. Early diagnosis of HIV infection is important to prevent its transmission to others and to allow evaluation, monitoring, and early treatment of the affected person. Treatment of HIV-infected mothers during pregnancy, precautions at birth, and avoiding breastfeeding can minimize the risk of passing the infection from mother to child.